So today we are interviewing community integrated medicine at MSUCOM.
I want to start off by asking you guys if you guys can tell us a little bit about yourselves and the organization that you guys are a part of.
So my name is Rodan Meccano. I'm a second-year osteopathic medical student at MSUCOM. I'm a non-traditional student, so I'm 29 years old. I went to undergrad at University of Michigan, majored in neuroscience with a minor in Asian languages and culture. I'm Filipino American. After undergrad, I did a master's program in medical sciences and mental health at Boston University, and then ended up working for a couple of years overseas in the Philippines in community-based drug rehabilitation capacity programming.
Kate Bailey. I'm also a second-year medical student at MSUCOM. I majored in biology with minors in chemistry and statistics. I went to undergrad at Olivet Nazarene University in Illinois. One kind of cool thing about me is I worked in the pharmacy for 4 years before I started med school. And one of the pharmacies I worked at was in a downtown area that was very underserved. And so I got to see a lot of those health disparities firsthand. So I'm trying to bring some of that experience to this talk today. I'm also married, so that's fun. A dog, so that's about me.
Community Integrated Medicine Organization.com is kind of one of the service organizations that provides hands-on activities for the med students to really try and integrate and interact with the community, both at MSU in East Lansing, but also at our satellite campuses or sister campuses at MSUCOM and DMC. Prior to the COVID pandemic, we did a lot of health screenings, health fairs, usually at the YMCA, schools, at MSUCOM and DMC. I think Kate can tell you more about that, but they've also got mobile clinics where they go out and get opportunities to screen the local community.
I didn't get a chance to do the mobile clinic before the pandemic shut everything down, but I was able to volunteer at Huda Clinic, which is a little bit more of the Detroit campus's like baby, but it is a free clinic that provides services to people who like need it. And I volunteered there before, and it was such a rewarding experience. Like not only helping people, but just as a student, it was a great learning experience of learning kind of like what it's actually like. You got a taste of what it's like to be a doctor. So, you did the interviews, you took down the history, all that. You could do some physical exam if you felt comfortable to, and then you reported everything to your attending. And so that was, again, a great experience, and I hope that we're able to restart that in the coming months.
And beyond the health fairs, we also do some speakers, medical education events. We had one in partnership with our Islamic Medical Student Association on how to take care of our Muslim patients and interact with them. We also have a series on COVID and just the general science behind it, the progression of the disease pathologically, and also pharmacy and treatment.
Can you guys go into a little bit about what inspired you to join the organization?
The big reason I'm so passionate about SIM is that, again, it gives you those hands-on experiences that are sometimes hard to find as a medical student. And paired with that, just the organization as a whole has this passion of helping the underserved, and I really want to be a part of that.
For me, it's based out of my experiences working in the Philippines and just seeing communities take care of themselves and also, the individual members. I'm very interested in primary care, like family practice, and I feel like there's so much work that physicians can do outside of just, taking care of your patients in clinic and doing your best to take care of their health and mental health needs, but what can you do also to address or to advocate for communities, the community needs, and how you can integrate your role with what is needed, in your neighborhood.
What are health and healthcare disparities, and what does your organization do to address them?
I guess to me, health is kind of vague, but I guess it's your overall well-being. It's multifaceted. It's your many components: your physical health, mental health, emotional health, spiritual health, just kind of your overall wellness. Health disparities are any sort of shortcomings or differences in your health status or your disease burden based on things that are part of that individual's identity, whether it's race, ethnicity, gender, disability status, socioeconomic status, or anything like that.
Yeah, to me, healthcare disparities kind of comes down to the different starting points as far as healthcare goes. And we would like to think that everyone has the same starting point when it comes to access to healthcare and, their health in general, but that's not the reality. And healthcare disparities is that difference in the starting points, like Rodan said, based on socioeconomic factors.
We wanted to know from your perspective as med students at MSUCOM, do you feel like you've been given the proper education to deal with health disparities in medicine, like in your training?
I feel like there's always going to be room for improvement. One really exciting thing that happened just a few months ago was in our dermatology course, there was a big push to have dermatology pictures, so of the skin, of many different skin colors, because that's one sector of medicine where the disease may present itself very differently depending on skin color. And for many years, we would only learn what a disease would look on white skin, or maybe if it happened more often, like in darker skin, we would see pictures of that. But we really got to see this year both light skin and dark skin for each of the diseases. And I feel like that's one kind of easy thing to shorten those healthcare disparities.
That's actually really interesting to hear, because Tanisha just researched and made an Instagram post for us about how skin cancer and POC, they weren't trained to see the differences on the skin. So
Yes.
to hear about that change is it's really cool.
And there are a bunch of, if you're on Instagram, which I'm sure that we all are on Instagram, so I think Brown Skin Matters is a really popular one. For the question on, what MSU has been doing, there's always room for improvement. And I think that part of that is not just approaching education on healthcare disparities as a single subject and keeping it in a silo of, okay, we have to learn about healthcare disparities. This is our healthcare disparities module, or this is our healthcare disparities week. Same thing for diversity, right? I think it's something that truly needs to be integrated into curriculum, into each system, into each semester, and kind of build. So whether that starts with implicit bias training in your first semester in your first year, and then that builds to, what is cultural competency? How does this disease affect the skin? How Black and African Americans, react differently to ACE inhibitors and other hypertensive drugs. We're in our cardio unit right now, and there are different protocols based on race. And whether or not, you believe in race-based medicine, I think that those are things that could be integrated into the curriculum. And I think that it's one thing to start, and it's good to start the conversation, but I think moving forward, MSU and all med schools, this is something that's going on across the country, should be having the conversation at a deeper level moving forward.
We've also been doing a lot of integration with the LGBT community on integrating their health needs, not just having one lecture on it, over 4 years, but whenever it's applicable, we'll, in every lecture put something about this is concerned that someone in the LGBTQ community might need, and just getting more familiar with different pronouns and stuff like that. I feel like that's also can tie into healthcare disparities as well.
That's so cool and definitely really important, right now during this time and everything. The reason we asked all this is definitely because recently we interviewed another doctor, and he was telling us about during his education and when he was in college, they didn't really go into depth about things like this, and they definitely did not talk about how to treat LGBTQ patients, and that's really cool that you guys are doing that. We wanted to ask if there's anything specific you guys think should be changed in the medical education at MSUCOM.
The specifics would be being more intentional about how they integrate or how we have the conversations, making sure that it's not just checking the box for accreditation for the college, And that's, one of those things that large institutions take a long time to change. And, I think students and myself and Kate included just have to do our best to keep advocating and voicing the changes that we want to see, and do our best to and not get too jaded by the system and, keep moving forward by it.
Sure.
Like, the only thing that I can think of is, like, sometimes, like, the language we use, like, in lectures, like, that bothers me when we're like, oh, we need to treat the blacks, with this medication. I feel like it's a little bit of a microaggression of, if I was part of that, it wouldn't make me feel good. We should be more intentional with our language when we describe these different communities, instead of kind of lumping them all together. Medicine's hard. So we often, kind of use blanket, like, rules to help us treat people better. And not everyone falls into those boxes, recognizing that people may not fit into, like, our treatment boxes that we're used to, and being intentional with that, of trying not to treat everyone like the same with the same skin color. And
I appreciate how both of you said that, like, health disparities shouldn't be one conversation, because I didn't think about that, but as a woman of color, like, it's not just one aspect of my life, it's integrated in everything that we do. So I think that's really important, and it's overlooked that it should be integrated into every aspect of our education.
So do you guys have any advice for how we as teens and also other people in our community can be more involved in combating this issue?
as far as health disparities go, and I'm not sure, like, how applicable it is to right now, but you guys are going to be the future of medicine. Coming up with treatment rules of, if when someone comes in with these symptoms that you'll treat them this way, that's one of the best ways to fight against healthcare disparities, because then you can't even inadvertently decide to give someone less care than you would normally. And that was something that I thought was kind of surprising, because there's so much emphasis on, like, implicit bias training. When I was looking into it, they said the most important thing is to, like, have in your mind how you're going to treat people who come in, like, with these symptoms, that you can't inadvertently give them, like, lower quality care. And I think that's really important.
I think what you guys are doing right now is actually one of the best things that you could be doing. So, like, doing things like this, spreading awareness, it's never too early to learn. And I think, going back to the idea of starting the conversations early, I don't think it's ever too early to start thinking about, like, the different aspects of your identity, the implicit biases that you may hold, and trying to, increase your own awareness and have those difficult conversations, because they are hard. Like, no one wants to, like, realize, wow, I am discriminating against XYZ people that I didn't even know, or these are the many microaggressions I did today, and that's not great. But until we figure out, until someone calls us out on them, how are we supposed to know that, like, how our words or actions are maybe impacting a particular individual? So education, and I think that's kind of, like, cliche to say that, educate yourself, read, be willing to, like, be uncomfortable, because I think when you're uncomfortable, that's, like, the moments that you're growing the most. Because I feel like if you're never uncomfortable, that means you're just living conservatively. Like, you're
True. Yeah.
you're not trying hard enough if you don't feel like you're taking any risks. So yeah, I think this is awesome. And vote. I know that we just got over this, but, like, same thing for your, like, local elections, state elections, because those are, like, directly impacting you and your community.
Actually, our last question. Do you have anything else you would like to say?
I'm just, like, jazzed you guys are doing this. It's really cool.
Yeah.
Thank you guys for coming today. We really appreciate it.